we have a question here so the question reads that my mother's blood sugar was normal a few months ago, but now her fasting glucose and HbA1c are high. Does this mean that she has diabetes, or could it be temporary?
Yeah, that's a good question. So, in terms of diabetes, one has to again diagnose it based on not just blood glucose, but other factors as well. So, just one reading of blood glucose being high does not necessarily suggest this is diabetes. Again, with A1C as well. So, you have, pre-diabetes, diabetes as a spectrum, right? So, depending on how high the A1C is, the A1C is nothing but a snapshot of your blood glucose. So it basically tells you whether your glycemic control is good or not over the past 3 months. And so typically, if you have a increased HbA1c and increased fasting glucose, it does suggest you are highly likely to have diabetes or pre-diabetes, and those patients need to be, followed up closely with glucose and A1C repeated, and before, confirming or before putting the patient on anti-glycemic agents. Obviously, I'm not an endocrinologist, so I cannot tell you the treatment part, but as far as the diagnosis part, from a lab perspective, at the very least, one needs to perform fasting glucose, HbA1c, as well as total glucose, and then look at other markers such as ESR, creatinine, BUN.